In 1907, Adventist HealthCare opened Montgomery County's first hospital. And in all of the lives we've touched over the past 110 years, one thing has remained constant: our skillful and compassionate nurses. While the uniform has changed, our nurses today still carry out our mission with sharp minds, tender hands, and a healing spirit that our community depends on in its moments of need.
I felt as though they were all carrying me, sharing my burden, providing love and true joy during a difficult time.
Every nurse was thoughtful and patient in their interaction with me and my wife for an excellent experience under trying circumstances.
My nurse was always available and offered enormous support. She was sincerely there for me throughout this entire experience. I consider her a bestie. I really believe that my nurse saved my life.
My nurse had a very open and friendly personality. He knew how to make me feel comfortable. I hate needles, but I didn't feel a thing when he put in my IV. He's the best.
In my 86 years, I rank this team in the top 5% of all professionals with which I have been associated. They encouraged me to exercise, demanded more productivity, and continually motivated me. Their warmth and humor always made me smile, and I assured them my smile was not a grimace.
Their smiles and laughter made it so much easier for me. My post-op nurse took the time to make me feel safe, comforted, and cared for. She was so kind and sweet that I was able to relax and let someone take care of me for a change.
My nurse exudes compassion and professionalism. I was made to feel that I'm the most important person with the level of care she provided.
The care my husband received during his entire stay at the hospital was exemplary. The nurses could not have been more caring of a patient. I was there every day, and not once did I observe even the smallest misstep.
My nurse has been so helpful and caring. I really appreciate how I can tell she really loves to help people. She made me feel like I'm the only person here.
Not only did the nursing staff perform their responsibilities with incredible skill, but with a level of patience and kindness that calmed us and encouraged us during a very stressful and scary time. They all were, in short, like angels.
All of the nursing staff was spectacular, and they were all very sensitive to my situation. I had just lost my husband, and they would often sit with me, and we would cry and pray together.
When I suffered a stroke during the night in the hospital, my nurse sat with me for over an hour holding my hand as my whole right arm was shaking uncontrollably. I knew I was having a stroke and I was scared about what was happening to me, but my nurse stayed with me and helped me through it. I don't know what I would have done without her. She cared for me, comforted me, and took the time to make sure that I understood what was happening. I'm forever grateful to her.
When nurses enter their profession, they don't just choose a career, they answer a calling. Across Adventist HealthCare, nurses are answering their calling in many ways. Whether it's hours at the bedside, or walking into a patient's home, or a checkup at an urgent care center, or greeting a patient at the front desk, or meeting with leaders to help reach our goals, we are blessed to have compassionate and quality nurses throughout our organization. We thank them for being on the front lines of extending God's care.